how to do a rapid qualitative review, or within Cochrane, we call these a qualitative evidence synthesis. Now, this, as I say, is an exciting collaboration. On the one hand, this is looking at qualitative evidence synthesis, which is a methodology that has been around for about 20 years, but popularized over the last 10 or 15 years. And of course, what's commanding the attention of many of us nowadays, rapid reviews. So this paper that we conceived is really the confluence or the overlap between the qualitative synthesis method and rapid reviews considerations. And you'll notice that as we go through in terms of the recommendations, some drawing on the wider field of QES and others drawing on the guidance recently produced from the rapid reviews community. So this collaboration brings together two Cochrane methods groups, the Qualitative and Implementation Methods group and the Cochrane Rapid Reviews Methods group, the group that's hosting this particular session, as indeed for all the sessions so far in the series. And you can see here that we have three of the Qualitative and Implementation Methods group conveners and two representatives of the Rapid Reviews wider group. And that constituted our core authorship. And we chose this particular authorship because of involvement in a variety of models of qualitative evidence synthesis for a number of customers, including health technology assessment agencies, internally within Cochrane, and national funding governmental agencies. So I thought it'd be helpful, because some of you will be coming new to the topic of qualitative evidence synthesis, to actually give you a little bit of the history of rapid QES, or RQES as we've got it abbreviated here. So here we've got the definition of a rapid review, adapted just slightly for qualitative research. So a rapid review brings together and summarizes information from different qualitative research studies, and very much within the window of opportunity provided by information for the public, healthcare providers, researchers, and policymakers, for whom this is particularly important, because we often speak of there being a policy window that we need to produce evidence for. And a rapid review essentially is done in two main ways: by speeding up the ways that we plan, do, and share the results of systematic reviews, and or by simplifying or omitting some of the stages that have been proposed for a review, as clearly explained by the authors of a review. So as I mentioned, this is part of a series of presentations and a series of papers. So here we have a summary of what the group, the authorial group, has been working on, and most of the presentations have now taken place. The outstanding webinar, which I would encourage you to join, will be given by my former colleague Fiona Campbell, who will be looking at how to do a rapid scoping review. But you can see that it covers a wide range of issues for reviews in general. And as Isolde said, looking through this and through my own involvement on the literature search team, I asked the question, where is the article on qualitative evidence synthesis? And it was really good to see the encouragement that the Rapid Reviews group gave to us to produce a paper, even though we started slightly behind the other authorial teams. And just to draw your attention to the high profile sort of flagship paper, if you like, that has been written by the conveners of the Cochrane Rapid Reviews group, that has actually been published in the BMJ earlier this month. So this is part of a rapid review series, but a bit of a health warning here, that one of the things that came out of our discussion of the early drafts was that rapid reviews is somewhat of a misleading label, because there are many reasons why we might seek an alternative to a conventional by which we mean 6 to 12 month qualitative review. And so within the paper, we specifically flag up a need to use this abbreviation RQES, yes, as a rapid QES to ally with the rest of the series, but also that reasons for abbreviation might include resource constraints. And so we're using the same abbreviation for other types of resource limitations. So it includes limited budgets, so maybe where you're not able to throw multiple reviewers at a particular problem. It includes the circumstance typically faced by PhD and master's students who will not have members of a review team, a second review team, will not have access to an information professional, or certainly not working side by side on a dissertation or thesis, and also the scenario where the overall review period might be conventional, but it might be made up of multiple components or multiple topics. Therefore, each of those mini reviews, if you like, is done rapidly. And in the context of quantitative information, we've got an example where we're doing 10 reviews within a larger context, and that can apply equally to qualitative reviews, doing multiple topics that are reviews in themselves, if you like. So all of these are resource constrained, and so the guidance that we're going to be sharing with you is designed to help us in those circumstances, although as I say, it fits very much within the philosophy of the Rapid Reviews series. And what we want to make clear is that doing things rapidly is not an excuse for doing things badly. And those of you who are familiar with the area of rapid qualitative synthesis will know that there was this thorn in the side of many of us working in qualitative evidence synthesis, where this commentator actually criticized much of the production of qualitative syntheses for being quick and dirty. And obviously, although there's an element of defensiveness about this sort of criticism, implying that there is a particular way of doing reviews, we have to be aware that these reviews must pass the quality threshold, that we're not saying we're doing them quickly as an excuse for them being of a lesser quality. So to give you a little bit of the history or background, the sort of well, should I say the start for a profile for rapid qualitative evidence synthesis really came in late 2019. At about the same time, our article led by my former colleague Fiona Campbell, in collaboration with CADTH, the technology agency from Canada, we reviewed the existing examples of rapid QES so that we could see what they had in common, what methods they used. And so this was very much an audit of what was currently going on. And what we identified at that time was a lack of methodological guidance. Soon after that, a publication which is squirreled away on the HTAI site from Healthcare Improvement Scotland provided an overview on how to do a rapid qualitative evidence synthesis. And to a certain extent, this is the only guide from a sort of corporate organization, if you like, that covers the steps of the rapid QES, although organizations like CADTH do have overarching processes for this. And so it was indeed CADTH in a supplementary paper from our collaborator Laura Weeks and colleague that looked at their own experience within the CADETH agency of conducting these rapid qualitative evidence syntheses. And you can see on the right-hand side here the experience that they gained and their lessons that informed our subsequent methodological work for this paper. So another landmark by one of our co-authors on the paper, Catherine Houghton, was the first of the Cochrane qualitative evidence syntheses done within a rapid timescale. And as with so much of the rapid review activity, this was done in response to the COVID pandemic. It was looking at barriers and facilitators to adherence with infection control measures in the context of COVID, although drawing on other similar conditions, given that it was early in the experience of COVID. And one thing to notice here is that they identified 36 eligible studies, but perhaps first for some of you in the context of systematic reviews, they sampled 20 of these, so it wasn't a comprehensive sample. And so that's one of the things to look out for in the guidance is the approach to sampling. And I believe the exact time scale from the meeting with WHO through to it appearing on the Cochrane site, having gone through all the Cochrane processes, was 25 days. It's summarized on the slide there as 4 weeks. And as mentioned earlier, I had a methodological role on this, being on demand to answer questions as a team that worked through working weeks and weekends, worked industriously to produce this review, which is, I believe, is somewhere in the region of 500 citations now. So certainly it filled a specific need. And the team obviously disseminated their findings through a number of publications. And so it was really at this point that rapid qualitative evidence synthesis became part of the Cochrane Review family. And this gave an opportunity for lessons to be learnt in terms of methodology. And again, these have been 2 key papers that we've drawn upon in producing the guidance. The experience of the evidence synthesis Ireland team, chronicled for us first by Linda Biesti in the paper A Quest for Speed, and then looking more at the work processes rather than the technicalities of the review, a paper led by Pauline Meskel in the International Journal of Qualitative Methods. So we've gone through a whole cycle of having some guidance and some experience, having some flagship qualitative syntheses, and then reflecting back on lessons learned. And that's very much the story so far. And to that, we're very pleased to be adding this paper released on Valentine's Day, a paper that you're going to love, obviously, that is on guidance on rapid qualitative evidence synthesis. And this has appeared along with the others in the series in BMJ Evidence-Based Medicine. And this paper contains 20 recommendations that distills our collective experience, both as individuals, members of those teams that we've discussed already, but also from published lessons as well, and our response as people working with qualitative reviews to the generic Cochrane Rapid Review guidance. So if you like, we've been applying a qualitative synthesis filter to the more generic guidance produced and authored by others in the writing team. And we've sought, as the other papers do, to cover the whole review process, but as is the case with the Cochrane Qualitative and Implementation Methods Group, we're stopping short of endorsing a specific approach or single method. So it's a framework, if you like, for multiple people to undertake Cochrane rapid or resource-constrained QES. The paper itself is the tip of the iceberg in the sense that it's accompanied by a supplementary appendix with evidence cited where available. Obviously, much of this evidence is from QES more generically, more generally, but also it's been refreshed by current work that's been going on in authoring the Cochrane and Campbell Handbook of Qualitative Evidence Synthesis, which will be which is currently being completed and will be available later in the year. And so we've been able to benefit, for example, from the authorship of Jane Noyes, who's a co-editor of that particular publication. So bringing all of this together, we're able to look at the existing evidence, look at current thinking about methodology of QES, and we hope that the paper will also be a starting point for a methodological agenda, because many of these questions remain unresolved. And so the whole paper is really sort of interim recommendations, as indeed many of the other Cochrane Rapid Review papers will be, continually changed as the evidence comes out. So the approach we've used is common to the Rapid Review series papers. We've gone through the stages of the review, as well as having some recommendations for the overall process. This graphic here is from the new Cochrane module, interactive learning module number 12, which has again been launched this month, Introduction to Qualitative Evidence Synthesis. And although that covers the conventional process rather than the rapid process, these stages are common to both. And by using this sort of structure, and with the co-authorship of Jane Noyes and myself across the module and the handbook and this article, we're hopefully joining up these different strands. And it's intended, therefore, that this will follow the QES process, it will mirror the chapters in the book, and it will complement the other articles in the Rapid Review series.